we're going to show how you can use the combination of the SouthMed Suzy hood, a home CPAP machine, and Fisher & Paykel's AIRVO to allow you to deliver high inspired oxygen concentrations to the patient without having to use as much oxygen as you would normally anticipate. We're going to apply the viral filter to the expiratory port on the right of the helmet. You can tell where the front of the helmet is by the two ports here. So I'm just going to take this filter out, and we're going to apply the filter. Now this filter doesn't fit directly on. Some filters will and some won't. It will depend on the gauge of the connector. So I'm going to use a standard female to female connector adapter and apply that to the expiratory port of the helmet. So it's very important to make sure that any gas monitoring port on the filter is on the outside, so any gas being vented is free of virus. So the next thing we're going to do is remove the free breathe valve before we put the helmet on the patient. That just means that the inside of the helmet is open to air until we've connected up the gas supplies. Tony and Louise are going to apply the Fisher & Paykel nasal cannulae to Max and show how we use this within the helmet. There are instructions on the inside of the packet to assist you, and we are going to do something slightly different in this instance, which is we're going to also use some tape as well as the normal strap, because if the nasal cannulae slip whilst you're in the helmet, it is somewhat fiddly to get it back to where it should be. So once we've got them on Max in the right position, we're actually going to tape them as well. So Max, we're just going to pop these little cannulae at the bottom of your nose. The straps go over the ears. And then we'll just tighten the strap a little bit. So now we're going to apply some Hypafix tape over the straps just to reduce the risk of them moving inside the helmet, because it is fiddly to get the nasal cannula back into the right position once the helmet's on. So we're going to put Hypafix on both sides, and we'll pull the seal to the frame. Close your eyes please, Max. We gently pull down, taking great care not to dislodge the nasal cannulae, and we do need to pull the nasal cannulae up into the helmet. We're going to take out the bung or stopper from one of the ports, and we're going to pull the Fisher & Paykel tubing up, and then from the inside of the helmet we place that into the port, and you can just see that coming through now. And the next thing we're going to do is connect the other end of the Fisher & Paykel from the AIRVO into the nasal prongs. Next, we're going to apply the straps. We're going to inflate the head and the neck cushion. And next, we're going to put the free breathe valve on. Shall I do that? Because it tends to be a wee bit sticky. So that we'll apply the free breathe valve and make sure it seals and locks. So the next thing we're going to do is start the flow from the CPAP machine. And we'll see the helmet now fully inflate. And again, for the purposes of the demonstration, we'll attach our capnograph to the expiratory port of the valve. Now on this occasion, we're going to apply the oxygen not to the CPAP machine, which is going to the whole of the helmet, but to the AIRVO machine, which is only going to the nose. And Tony's going to switch the AIRVO machine on. And because the CPAP machine is delivering relatively high flows to the helmet, we tend to use low flows on the AIRVO down around 30 to 40 litres a minute. The only thing to note when using the AIRVO in the helmet is the AIRVO is designed to cut out and think that there's an obstruction above certain peak pressures. And if the peak airway pressure rises above around 8 centimetres of water, the AIRVO will frequently alarm and cut out, thinking that there has been obstruction. If a patient does need higher CPAP levels than 8 centimetres of water, you can just deliver the oxygen to the nose, not using the AIRVO. So, in order to demonstrate the oxygen conserving properties of giving AIRVO into the helmet, we have in the lab used 2 separate capnography and oximetry devices simultaneously, where we've got both this GE oximetry set up as well as the Mindray on myself earlier in the day.